Good day. My name is Scott Hara. I am the Director of Digital Content at UMHS's North American Administrative Offices, and we're speaking today with Class of 22 graduate Dr. Shivaan Oomrigar. And Dr. Oomrigar, tell us a little bit about yourself and where you are going to be doing residency, and just a little bit about where you're originally from also.
Good morning. Thank you for the introduction. I
Sure.
appreciate it. So my name is Dr. Shivaan Oomrigar, and I am originally born and raised in Jacksonville, Florida. And I will be completing my internal medicine residency training at HCA Florida Kendall Hospital in Miami, Florida. And
Awesome.
a little bit about me, medicine has been involved throughout my entire life. It's weaved its web, and now it's pretty strong since I've matched. Other things about me that are non-medical are, which is probably more interesting. I'm a very big tennis player. I've been playing tennis
Wow.
since I was a little girl. I've even continued to play during med school, during clinicals, and now even in the post-match season, I've been playing a lot of tennis. I'm a huge foodie. I love to eat. And with that being said, I have to work out in order to keep the food off. So I am a big workout fan. I do Orange Theory, I do yoga, I try and do Pilates. And right now, between in the post match season, I'm just trying to enjoy the vacation time that I have before the madness starts.
Wow. So it sounds like you're really active. Did you always want to be a doctor? I mean, what was your undergraduate background in?
My undergraduate background was I majored in biological science with a minor in chemistry, and I graduated from Florida State University in Tallahassee, Florida. So I'm a big Florida girl, Florida everywhere.
Great. And what made you decide on attending UMHS over other medical schools?
That's a very good question. To be very honest, when I was applying in the States and to other Caribbean schools, everybody told me no.
Wow.
Every other school told me no. And for whatever reason they gave, the answer was still no. And UMHS was the only school that decided to take a chance on me. And now here I am, a successful matched graduate, about to go into internal medicine training. So I'm very honored and proud to have gone to UMHS and for them to have taken the chance on me.
Well, and we're so glad to have had you. And were there any professors or staff members in both St. Kitts or Maine or in clinical rotations that helped you along the way that you'd like to mention?
Yes. So most notably, the two professors that actually their classes I enjoyed the most were pathology 1 and pathology 2 with Dr. Jalan and Dr. Roy. They both
Right.
taught phenomenally, like phenomenally, to the point where if you just attended the lecture and you paid attention, that was enough studying to perform really well on the exams. And to be very honest, out of all the notes that I kept, I kept those notes because those were the ones where I knew I would need them in the future.
Right.
And even in clinicals, when I see a disease or I see a patient or I see a diagnosis, I can actually remember and visualize myself back in the classroom where they're teaching. And Dr. Roy would always beam with pride when we all performed well on his exams. You could see that glimmer in his
Oh
eyes when
yeah.
you finally understood concepts in his office hours. And even Dr. Jalan, his passion for teaching was unparalleled. The entire classroom came alive when he taught, and we were all so enamored and focused when he taught. And that's something I carry with me even today. So those two professors were great,
Oh,
absolutely great.
well, that's really great to hear. Is there anything specific about your medical education at UMHS that you think might have helped you match in internal medicine?
Oh my. So that is a very loaded question because the whole process of medical school helped me. I don't think there's one specific thing. And I feel like if I name one specific thing, I'd be dishonest to the rest,
Sure.
everything about the school from moving to the island, having to do medical school on an island, studying, friendships, matching, clinicals, the advisors, the teachers, I think all of those was a culmination of me succeeding in matching. And I think everything about it would help me succeed in matching. I couldn't say anything specific.
Oh, that makes total sense. And could you maybe explain a little bit why you wanted to do a residency in internal medicine, and just to explain a little bit about internal medicine for those that may not be familiar with it? I think a lot of times people confuse it with family medicine, but they are two different specialties, of course.
Right, absolutely. So, internal medicine is a specific field of medicine that focuses on the diagnosis, treatment, and care of adults across a spectrum of, many health issues and complex illnesses. And internists is what we're called, are especially trained in the diagnosis and treatment of puzzling medical problems. And of course, we focus on health promotion and disease prevention. And we can also serve as the ongoing primary care for many adults.
Of
And in
course.
family medicine, I can't really speak much about family medicine, but family medicine, you see adults, but as well, you get specialized care in the treatment of pediatrics and adolescent medicine, as well as OBGYN, versus in internal medicine, we don't get that.
Right.
And
And
go ahead.
no, I was just going to say, do you have any advice, or not advice, but anything specifically that that interests you about internal medicine as to why you wanted to go into it?
Yes. So my first experience with internal medicine was during my clinical rotations. That was
Right.
the first instance where I actually had to study for internal medicine, where I got to have hands-on experience with internal medicine. And I did my internal medicine core rotation as well as a sub internship in Chicago, Illinois with Dr. Scheinman. And in his clinic, and when we would go on the floors with him, that's where I fell in love with IM. And I love it because you work as a team to try and analyze and solve these complex medical cases, and you use multiple, counseling physicians and
Right.
consultants to work together to treat a patient, and it's a very much multidisciplinary approach, which is what I love. It's a giant puzzle where everybody gets to work together and we all reap the benefits when, of course, the patient succeeds, or, we find the diagnosis, we find the right treatment. It's, for me, it's combining the best of both worlds, science with the personalized touch and, personalized compassion approach to medicine. That's why I love internal medicine.
Great. And I may have asked you this before, but do you have any advice for current or incoming students just about attending UMHS and also the match process? I know we have a really great, as you know, academic affairs department that Patrick McCormick runs, and a lot of people follow his guidance. But do you have any advice for somebody that's about to go through the match process?
Absolutely. Um, the best advice I can give you is to stay the course, stick to
Right.
it, and don't give up, because you will definitely have 100% guaranteed ups and downs, and the
Of course.
downs will be very low. And sometimes you may feel like you're the only one there, but you're not, or you're the only one experiencing the lows, but you're not. My best advice is to stay the course, stick with it. Just because the path happens faster for someone else doesn't mean that it's not going to happen to you. It's just not your right time yet, but it will happen. So you have to be steady, have your eyes on the prize, don't waver, and stay the course. That is my biggest advice, because this is actually my second time matching.
Right.
The first time I did not match, and I
Right.
thought that I was the only one in this situation. I thought, how could this happen to me? I did everything correctly. I studied, I performed well on my board exams, I did well in school, I believed that I did well in clinical rotations, and it just didn't happen. So all of that has led me to that one piece of advice: don't waver, stay the course, stay steady, and it will happen to you. And now here
So
I am, successfully matched.
excellent. So persistence and perseverance, it sounds like, and that's why we're so glad to talk to you today. Um,
Absolutely.
what are some of your goals up for your upcoming residency offhand?
Some of my goals are definitely, I want to absorb as much as I can and to be,
Right.
the best internal medicine physician that I can. And hopefully, I'll learn from my peers, my attendings, and my mentors, so that I'll be, good enough one day to be nominated as a chief in my class, which is what one of my goals is, as well as, pursuing a fellowship in a subspecialty of medicine.
Great. And since you have you've actually been it's taken you a while to match. I'm sure that you have a little bit of experience, as we all have, with the COVID-19 pandemic. Do you feel, from working in your clinical rotations or just what you've experienced in hospital settings in the last couple of years, do you feel that this is a crucial time to be a doctor and that the public has a better understanding of doctors now after what we've gone through since 2020?
Absolutely. I think now, since the pandemic is, not as strong as it was before, we definitely have a better understanding. And, during the height of the pandemic, not just doctors, every single medical personnel was affected. And
Right.
in every setting, the hospital, the clinic, the ER setting, even the EMS personnel, everybody was affected. And, doctors and healthcare workers, of course, were right at the heart of the pandemic. And during that time, everybody was asking questions for which answers had not been found yet.
Right.
Science was not fast enough in that time period. But I believe each side did the best that they could, and given the circumstances. And I believe that, now that we have a good handle on it and with the vaccine, we all have a better understanding of the disease.
Absolutely. And what do you think most med students, and I know this was probably different for everybody, but what do you think most med students have learned from the unprecedented circumstances of the pandemic as we now move into coming out of the pandemic and being coming closer to the goal of everybody being vaccinated?
So I think most medical students would have learned that in a crisis, you have to pull together. Number one, you're
Right.
not just the internist anymore. You're not just the OBGYN. You are one of everything, because when situations like this happen, you have to be ready to act. And I think, the med students that were in clinical rotations or were in hospital settings during that time, I think they felt that. I think they felt that their presence was needed, it was recognized, and, that it was valued at the end. And now, with everybody being vaccinated, I think, we're all at a calmer level, since there
Right.
are answers
Yeah.
when those questions were asked during the pandemic. So I think we're all moving in the right direction.
Okay, excellent. And is there, you've been a great interview. Is there anything else that you would like to add that we haven't covered here?
Um, Let me think. Um, I don't think I answered your question about why I wanted to be a doctor. I believe I skipped over that.
Oh, yeah, go ahead.
I'm not sure. So you asked me earlier why I want to be a doctor, what has led me to this position. So I have my own personal journey with medicine. Like I said, medicine has been in and out of my life since I was an infant. So when I was a year old, I was diagnosed with retinoblastoma, which is a cancer of the retina in my
Oh,
left eye.
wow.
And long story short, I lost my left eye to cancer. And ever since that young age, I've worn a prosthetic eye in my left eye. And I
Wow.
remember from infancy, I have vivid memories of being on the operating table and seeing men and women in blue gowns and blue scrubs and blue scrub caps. And I remember them, being on an operating table and them trying to, put a mask over my face to lay me down for surgery. And that has carried me through all of my experiences, from regular school to undergrad to medical school and to now. It's pushed me to be a physician today. And, I feel that it's my not my job, but I feel that it's my duty to give back to those who helped me at a young age.
Of
And that
course.
is one of the most biggest reasons why I am a physician today.
Well, that's an amazing personal story, and I think it's should be very inspiring to a lot of people out there. That yeah, what an amazing story. You've come a long way.
Thank you.
Yeah. If there anything else, are you open to if students want to contact you? Would you be open to answering emails, or it's up to you?
Absolutely, yes. If anybody would like advice or needs some guidance or mentorship, I'd be happy to receive those emails and messages.
Okay, well, Doctor, I thank you so much for your time today. I think that you're going to help and inspire a lot of people. And best of luck to you in your upcoming residency.
Thank you so much. I appreciate the time and I appreciate this opportunity to be interviewed. Thank you.
Okay, thank you so much for your time today and have a great day, okay?
Thank you.